Françaises, Français,
French
mes
men
chers
and women,
compatriotes.
fellow citizens.
Depuis quelques semaines, notre pays
For
fait
some
face
weeks
à la
now, our
propagation
country
d'un
has been
virus,
facing the spread of a
le
virus,
Covid-19, qui a touché
COVID-19.
plusieurs milliers de nos compatriotes.
It has infected a number,
Et bien entendu,
a few
ce
thousand
soir, avant toute
fellow
chose, une
citizens.
pensée émue et
And this
chaleureuse
evening, I want to share
pour
with
les
you
familles et
how
les proches de nos
my thoughts
victimes,
go out to the families and friends
Cette
of those who are
épidémie
affected.
qui affecte
This
tous les
epidemic
continents
has touched
frappe
all
tous les
continents of
pays
the world
européens
and is
et
affecting
la
all
plus grave
European
crise
countries.
sanitaire
It is one of
qu'ait
the
connue la
most
France
serious health
depuis 30 ans.
crises that France has ever known for
Dans
a
l'immense
century now.
majorité des cas,
In a
le
large
Covid-19
number
est
of
sans danger.
cases, COVID-19
Mais
is
le
of
virus
no
peut
grave
avoir des
danger.
conséquences très graves,
Yet,
en
it can have
particulier
very
pour
serious
celles et ceux de nos
consequences,
compatriotes
especially for those
qui sont
men
âgés
and women
ou affectés
in France
par des
who are
maladies
elderly
chroniques,
or who are
comme
suffering
le
from chronic
diabète,
disease, such
l'obésité
as
ou le cancer.
diabetes, obesity, or cancer.
Durant plusieurs semaines, nous avons
For some
préparé,
weeks now, we have been
les
preparing
personnels
and
des
acting.
hôpitaux, médecins, infirmiers,
Medical staff,
ambulanciers,
doctors,
les agents des
ambulance
cellules de nos
workers,
hôpitaux, les médecins
nurses,
de ville, l'ensemble
paramedics,
des personnels du service
general
public de la
practitioners,
santé en
all
France
people who work in the medical
sont
sector in
engagés
France
avec
have been working
dévouement et
tirelessly
efficacité.
to tackle
Si nous
and
avons
stem
pu
this disease,
retarder la propagation du virus
while we have
et
been
limiter les
able
cas
to
sévères, c'est
limit
grâce à eux.
the spread of
Parce
this
que tous
disease,
ont
the spread of the
répondu
virus,
présent.
it is
Tous
much
ont
thanks to their
accepté de
work.
prendre du temps sur leur vie personnelle,
They have taken
familiale,
out time of their own work lives, but also their personal lives, to protect the health of their
pourquoi,
fellow citizens.
en votre nom.
And that is
Je
why,
tiens avant toute chose à
on
exprimer
your
ce
behalf,
soir
I would like to express
la
this evening
reconnaissance de la
my
nation
deepest gratitude
à ces héros en
unto
blouse
these
blanche,
people,
ces
these
milliers de
heroes
femmes
in
et
white
d'hommes
lab coats,
admirables qui n'ont d'autre
who have
boussole
worked
que nos
tirelessly
soins,
and who
d'autres
have shown
préoccupations que
such
l'humain,
stoicism
notre bien-être,
and
notre
compassion
vie, tout simplement.
to protect our people, our lives and our
Je veux aussi
health.
ce soir saluer
This
le
evening,
sang-froid
I would also
dont
like
vous
to
nous
take the
avez fait
time to express
Face
my
à la
gratitude
propagation
unto
du
you for
virus,
being
Vous avez pu
so
ressentir pour
calm.
vous-même, pour vos proches,
You have
de l'inquiétude,
proved how
voire
calm
de
you can be in
l'angoisse, et
face
c'est bien
of the
légitime.
virus and not give in to
Vous
deep-seated
avez su
concern
faire face
and panic.
en ne
You have
cédant
been
ni à la
able
colère, ni
to
à la panique.
not give
Mieux,
in to fear
en
nor
adoptant les
panic.
bons gestes, vous avez ralenti la diffusion du
acting
virus et ainsi
Intelligently,
permis
you've
à
been
nos
able to
hôpitaux et
stem
nos
the spread of the
soignants de mieux
virus,
se
and you've been able to enable our medical staff
une
to
grande
better
nation.
prepare themselves. And that
Des femmes
is
et
what
des
makes
hommes
France such a great
capables
nation.
de placer l'intérêt collectif au-dessus de tout.
You have
Une
been able to
communauté
place the
humaine
greater
qui
good of
tient
all above
par des
own
valeurs.
personal interest, and this is because
La
we all share
solidarité,
values of
la
solidarity and brotherhood.
Cependant, mes chers compatriotes, je veux vous le dire
Nevertheless,
ce soir avec
My dear
beaucoup de
French
gravité, de
citizens,
lucidité,
it is with,
mais aussi la volonté
concern,
collective que nous adoptions la bonne organisation.
but it is also with a very
Nous ne
clear mind
sommes
that
qu'au
I am
début
here to say
de
that
cette
we have
Et
taken
partout en
action and
Europe,
we will take
elle
action.
s'accélère.
But for the time being, we are
s'intensifie.
only at the beginning of this epidemic
Face à
in
cela,
France, but
la
also in Europe,
priorité
and things will
absolue pour
continue
notre
to
nation
accelerate
sera
over the
notre
coming
santé.
weeks and months.
Je ne
Our primary
transigerai
concern
rien.
is your health,
Et un principe
and I will work tirelessly to
nous guide
protect
pour
your
définir
health.
nos actions. Il nous guide
And we have
depuis le
scientific
début pour anticiper
assistance
cette
to
crise et pour
guide
la
our
gérer
policy
depuis plusieurs
decisions,
semaines.
and they've been
Il doit
working with us
continuer
ever
de le
from the
faire.
beginning, and they will
C'est
continue
la
to work with
confiance
us.
dans la science.
But
C'est
it is trust
d'écouter
and belief in
celles et
science.
ceux
It
qui
is
savent.
listening to those who
Les plus
know
grands spécialistes
that we
européens
can
se sont exprimés ce matin
protect ourselves
dans
the
une
best.
publication importante. J'ai réuni aujourd'hui
This morning
avec le Premier ministre,
and
le
throughout today,
ministre de la
I met
Santé,
with a number of ministers, the
notre
Minister for
comité
Health,
scientifique de suivi.
our scientific monitoring committee as
Nous avons
well.
en France les meilleurs virologues, les meilleurs
And in France, we have the best
épidémiologistes,
virologists,
des spécialistes de grand renom, des
epidemiologists,
cliniciens aussi,
specialists
des
of
gens qui
international
sont sur le
renown,
terrain et que nous avons
people who work in the
écoutés comme
field
nous faisons
and who carry out
depuis
research.
le premier jour.
And these are people who have been listening to from the very
Nous ont
beginning
dit que
of this
malgré nos efforts pour le
viral
freiner,
spread.
le virus continue
And
de se
thanks
propager.
to their efforts, we have been able to stem the spread. And yet, despite
Nous
our
le
best
savions,
efforts, the virus is continuing to spread and accelerate.
Ce qui risque de se passer, c'est
What
que la maladie touchera
is very
d'abord les
likely to
personnes les plus
happen
vulnérables.
is that this virus
Beaucoup
will
d'entre
affect
eux
the
auront besoin
most
de
vulnerable
soins
amongst
adaptés
us,
à l'hôpital, souvent d'assistance respiratoire.
and often people who
C'est pourquoi
require
j'y reviendrai
assistance,
dans un instant. Nous prenons
require
des mesures
respiratory
très fortes
assistance, will end up in
pour
intensive care units in
augmenter
hospitals.
massivement nos
And it is for
capacités
that reason that we need to be able to
Car
boost, and I have put in
l'enjeu
place
est de
systems to be able to
continuer
boost
à aussi
the
soigner les
hospital's ability to take in such patients.
C'est aussi
We also have to be able to prepare for a second wave of this virus, which will come later to a lesser effect and will affect other people, the younger people, who will also need medical care. Given this context, we have to protect the most vulnerable amongst us, and that is of paramount importance. We have to be able to stem the spread of the epidemic so that we can protect our hospitals, our emergency services, our intensive care units, and our medical staff, so that we can continue to treat patients who are most affected by the disease. These are our priorities. We have to continue what we're doing to try and save time, and we have to continue to monitor those people who are the most likely to be affected. And that is why anyone over the age of 70 years of age, those people suffering from chronic disease or respiratory disease, any disabled people in France, I call on you to stay at home as much as possible. Granted, for those other people who would like to go and meet and see with these people, do so to help them carry out their grocery shopping or any errands they may have to do, but limit your contact with these people as much as possible to the bare essentials. For the local elections, there is nothing which will stop us, and I will do nothing to stop anyone in France from going to those elections. I called on my Prime Minister also to speak with and converse with all of the political groups and to inform themselves of the best paths and avenues to follow. Town halls and the government services have done everything that they can to ensure that the elections will go ahead safely. We have done everything so that the advice that we have been getting in terms of social distancing will be respected. We want to ensure, despite all of these measures, that we can continue to live in a democratic society, and that is why the elections will go ahead. So the priority today, as I said, is to protect the most weak and vulnerable. These are the most affected by this epidemic. Second, we need to curb the spread of the epidemic. The Minister for Health and the Director General for the Health Department have said that we need to do this so that we can avoid having an overburden of our hospitals of people suffering from respiratory disease. And as of Monday, schools, daycare centres, universities, high schools will all be closed. And this is for a very simple reason. Our children, the most young people of this nation, again according to scientists, are those people who are most likely to spread the virus at such a fast rate. Now, while children may not have any symptoms, and it seems to be, for the time being, that they don't suffer from the most serious versions of the viral disease, they spread it. And this is, in closing these schools, this is a way of stopping the spread across France of the virus. There will be a region-by-region system to be able to ensure daycare centres so that those people who are essential in fighting this disease will be able to have their children looked after while they continue to fight against the disease. So we'll set up these centres throughout the regions, and we'll be speaking with all of the elected members of parliament and all of the local members of parliament in how to best set up these centres. When possible, we want companies to allow their staff to work from home. It is already something that has been put in place, but it needs to be ramped up. For public transport will continue to operate because it is essential. And this is where I call on each and every one of you. I want each and every one of you to only travel when absolutely necessary. The French government will also call on the French people to limit any large gatherings as much as possible. And at the same time, our health system has to continue to prepare itself, and here I'm talking about intensive care units, to take in not only people affected by the most serious strains of the virus, but also to take in those people who are suffering from other ailments. We have to be able to free up as many hospital beds, and we have to have enough medical staff on hand to be able to tackle this. This is why we will call on people who have recently retired, medical staff who have recently retired, as well as people who are still in training. I saw just in recent days the Paris-based paramedical staff doing fantastic work. And they were there to take on calls from concerned people. And we had doctors who were not on duty, who were also coming in to lend a helping hand. And at the same time, non-essential medical care for hospitals and non-urgent will be put back to a later date. This is a way of saving time and freeing up resources. Health comes at no price, and that is why the government will put in place as much money as possible to be able to provide medical assistance and to save lives, whatever the cost may be. A lot of decisions that we are currently taking, a lot of the change that we are implementing will stay in place because this crisis is one we're going to learn from. Our healthcare providers are amazing. They have been doing amazing work, and we will learn from this. And we will finish this crisis with a medical and a healthcare system that will be stronger all the better for it. We will also call on our research specialists, medical research specialists, to continue to work, to carry out fast diagnosis. We want efficient diagnosis. We already have a breadth of knowledge in the area and in France as well as in Europe. We have already started working on coming up with even better tools for diagnosis. We have professors who are already working on different ways of curing this disease in Paris, Marseille and elsewhere, in Lyon. Protocols are already in place, and hopefully in the first few months we will be able to roll out widespread cures, because Europe has everything at its disposal to come up with an antidote to COVID-19. Our teams are also working tirelessly to come up with a vaccine. But while we have nothing yet, I have great hope in their ability to come up with a vaccine. In France and in Europe, we are ready to come up with a vaccine, and I will continue to ensure that we will provide as much as possible to ensure that it happens. But the mobilization that I'm calling for is also a societal mobilization. The winter lock-in will continue for another 2 months. No one will be kicked out of their home in the winter time. We also need to do our best on an economic side. We need to be able to support all those people, bar owners, restaurant owners, people who work in tourism, in events, transport. All of our sectors in the French economy are suffering. Companies are concerned for their order books. And you, I am sure all of you are concerned for your jobs, for your purchasing power. And this is a concern that I share with you, because I can only understand that this concern will grow over time. But we need to avoid that in addition to the fear for our health, we should add to that an economic fear. People should not have to fear for their jobs. And this is why we will implement everything that we can to protect employees, protect French companies. Whatever the cost may be, we will do it. In the coming days, an exceptional mechanism, widespread mechanism for partial unemployment will be implemented. The ministers have already made a number of announcements, but we will take their statements and take their promises even further. We will ensure that employees who have to stay at home will be compensated for that. We will look and have looked at what the Germans are doing. I want us to be able to preserve jobs, to maintain jobs and keep skills as well. We need to do everything to ensure that employees will stay working within a company even if they may have to stay at home. And we have to continue to pay them. We need to also protect our independent workers, our freelancers. And we need to do this to ensure that our economy will remain as stable as possible. Any company who wish it, without having to face any forms of penalties, will be able to delay the payments for tax and social contributions until the end of March. And we will work on working out a payment scheme for those companies. I want for this, for our economy, I need simple mechanisms to be put in place so that any monthly payments, any compulsory payments for the month of March will be suspended. Companies of all sizes will be protected. Employees in every industry will be protected. I have called on the government to start preparing a nationwide, European-wide bailout package, which we will implement now and in the future. We also expect to see a European-wide response to this crisis. European Bank has already started to take a number of decisions. Whether those decisions will be sufficient or not, I am not too sure. And I think future decisions will have to be made. And I want to be clear with each and every one of you. We, as Europeans, will not let a financial, economic crisis spread. We will react to the crisis, and our reaction will be strong and fast. We'll work with all European governments, and I call on all governments to support economic activity, whatever the cost may be. It is what France is going to do, and this is the policy line that I will defend and promote at the European level. And it is what I already started at the Exceptional European Council that was held yesterday. I will pay close attention to what the financial markets will do in the coming weeks and coming days. But Europe needs to stand united to protect its economy. We also need to be working on an international scale, and I call on all G7, G20 nations to take their responsibilities on hand. Tomorrow, I will call on President Trump to launch an exceptional initiative for the G7 members, because President Trump is the president of the G7 for the time being. We have to take on board the fact that this is a global crisis, and we have to act together, fairly, and united. Fellow citizens, all of these measures are essential for everyone's safety and security. And I want you to all embrace these measures and support them. But we need to do this together. We cannot deal with such an expensive crisis and without individual and collective discipline. We need to act together. I can hear that voices are rising up around the country, and they're saying both one thing and the other. Some people are saying that we aren't acting enough. Some people are saying that we are doing too much. So this evening, I'm trying to present to you what our nation needs to do together as a whole. We need to avoid two major pitfalls. On one side, we need to avoid falling back into nationalist tendencies, because this virus is not bound to one nationality, and we need to work together. France is doing its best to try and act in that way, and we are working with our European partners to do that. And we'll ensure that all of our European partners are on board with what we do in the future. But we also need to keep in contact with those areas of the world that aren't as affected as we are for the time being. We need to avoid the spread of panic. In the coming weeks and months, borders will have to be closed. But decisions that affect Europe will have to be made at the European level, because we need to take these decisions while ensuring the fundamental freedoms of Europe. We also need to avoid closing off and working as individuals, because it is only when you work together, as opposed to working alone, that you can deal with such challenges. It is when you say we and not I that you can truly find a solution. And that is why I call on your assistance in the days, weeks, and if not months to come. Our government cannot act alone. All of us have to act together. I call on you to abide by the advice that has been given out by the medical authorities. The basic, most simple gestures that you need to adopt that, unfortunately, even today, are not used enough. Washing your hands. You need to wash your hands sufficiently long enough with soap or with an alcohol rub. You need to greet each other without shaking hands or kissing each other on the cheek to avoid further contamination. It means keeping your distance, standing 1 meter away from other people. Now, they may seem very simple, but these are behaviors that can save lives. And that is why I call on you, in all honesty, to behave and along these lines. Because this will help you protect not just everyone, but even your families, your loved ones. It will help us protect the most vulnerable amongst us. Don't go and visit the elderly. I know it is something that will come for many as something which will give you a heavy heart, and it is hard to do. But instead of going and see them in person, call them. Speak to them by phone. Limit the number of times you visit them to avoid infecting them. If you are a neighbor of a medical professional who needs assistance in having their children looked after, provide that assistance. And I call on all companies to do everything that they can to protect their employees. I call on everyone, once again, to work together. I actually call on the government to work with all of the employment representatives to ensure that this crisis will not become too widespread, that we can work together. Because this crisis requires an intergenerational response. There is already so much that we can do and are doing at the community level. But again, it is when we stand together that we can do the greatest things. I know what the medical staff around the world have already done and what will continue to do, and my thoughts go out to them. The government stands behind them and supports them. I think of the medical staff who are dealing with most serious cases, the doctors, the paramedics, those people who are not working in the hospital systems, those people who are probably the most called upon. Currently, well, they will continue to be called upon in the coming days, weeks and months, and we count on you, and we support you. The Ministry for Health will come up with guidelines in the coming hours that will help you protect yourselves against the virus. It is the minimum level of respect that we owe you. And these rules and guidelines will be clear, will be proportionate, and as easy to follow as all possible. So I count on you, each and every one of you, to stand united as a nation, to prove what France is known for, to prove how generous we can be. This same nature within us that has enabled France in the past to overcome the greatest hurdles. But there will come a time in the future where we will have to learn from what we are living through. But it's this ability to learn that has seen us come through decades of crises and has shown the value of our democracy. What this pandemic shows is that universal healthcare, no matter who you are, where you come from, what your background is, should come at no cost. And it is essential. It is indispensable. What this pandemic shows us is that there are goods and services that should not fall into the sorts of logics that market influencers would have us think of. We cannot give up health, food, our basic living standards to market logics. We have to take things back in control. We have to stand as France, we have to stand as Europe, because it is France and Europe that have destiny in their hands. The coming weeks and months will require us to take decisions that will bring major changes. And I will take full responsibility for those changes. But the time now is for us to protect our fellow citizens and ensure that our country stands united. It is a sacred union that binds us together. It is a sacred union that pushes us to seek out the same destiny, to stop us from falling into the nasty pull of fear. It is this very nature of our nation that has enabled us to overcome so many crises in the past. Because a united France is something which helps us get through these dark times. We will stand strong when we stand together. Long live the French Republic, long live France.